So you're saying a lot of muscle atrophy and you were unable, like the muscles just weren't firing, right? Was it a one-sided thing? You're saying your right side. So when you kind of came back to lifting again, squatting heavy and all that, were you one side dominant or how did you fix that?
I ended up having both legs, two separate events. Legs had severe sciatica with numbness and tingling and weakness. I do think that over time, I do kind of have a little bit of a shift in my hips, the bottom of a squat. And I think it's my right side. So I've had these back issues for so long that it's leaked into other parts of my body. It's really bad hip issues. And I think that's a lot of the reason because my glutes atrophied and a lot of the force that my glutes had taken prior are now being placed on my hip joint. So my left leg is stronger than my right leg just because of baseball, because that's my left leg is the plant foot. And that's the leg that kind of acts as a catapult, plant into the ground. Everything else kind of rotates over it. So my left leg has always been stronger because of that. But in terms of the sciatic nerve muscles, like the glutes and hamstrings and calves, they both took a hit. So a little bit of atrophy in both sides.
Do you see clients that have back pain?
Yeah, I actually have this one guy in person. He has spondylolisthesis or something.
I know exactly what you're talking about.
But it's like his sacrum, this is his like L5, S1, and his sacrum is like this. It's like completely shifted. So his spine is supposed to be like that, but his sacrum is like here. So we kind of have to work on like tucking it back in, doing a lot of different core exercises and stuff, but it's hard to kind of navigate around that with certain leg exercises. In terms of like herniated discs with clients, well, I don't know if I have any. There has to have been some in the past because a lot of people have had herniated discs. But when I hear like I've had a herniated disc before, I think about myself and I just think, well, we need to just make sure your technique is where it needs to be and that you're bracing the right areas. And we don't have to train in any super specific way. We're going to train the certain things that you need to be good at to protect your lower back, which I would do with anybody, not just the person with back pain. Anybody that trains with me is going to be doing core work and glute work and stuff like that. So when I have a client that's had back pain, I just think of myself. I'm like, you're fine, man. Like a lot of your head is, I mean, obviously it depends on the severity. I'm not going to say if they're screaming in pain that they're fine, but a lot of people have a lot more in the tank than they think they do. And I don't like to completely overhaul my exercise program because they've had back pain, because I don't train myself any differently. But obviously, if they do have severe pain, I'll make adjustments. But I've had a few clients that have had back issues, yeah.
Do you think it's effective to, if they're saying, I can't squat, squatting hurts my back, to take them away from the squat for a little bit and talk about what you're saying, train the abs, train the glutes, maybe specifically isolate those and then come back to the squat later? Or how would you deal with something like that?
Well, if somebody says I can't squat because of my back, I'm going to ask them what type of squat, because there's hundreds of different types of squats out there. There is a variation of a squat that somebody can do without back pain. I would never say we're not going to squat. I would say we're going to find the type of squat that you can do without pain. That would be my philosophy on that.
Gotcha.